Hello viewers, welcome in our YouTube channel. In this video you will see about the PPE Kit, personal protective equipment, the doffing sequence and donning sequence for personal protective equipment. Now, what is the personal protective equipment? Personal protective equipment are protective gears designed to safeguard the health of workers by minimizing the exposure to a biological agent. Personal protective equipment for provided to health workers for protecting them from infection. Then, what is the component of PPE kit? PPE kit has six components: head cover, shoe cover, gown, N95 mask, gloves, and face shield. Then types of mask. There are three types of mask. First is triple layer mask. Triple layered mask has three layers, which is made up of non-woven material with nosepiece and surgical mask. This mask is also known as surgical mask. Then N95 or respirator. This is specially for health worker. This is non-collapsible, high filtration efficiency of 95% with expiratory valve. Then cloth mask. This is normal mask available in chemist stores. This is used in the community settings and administrative staff and for non-clinical staff can be reused multiple times after washing. This mask can be used after washing. Then reuse of N95 respirator. So N95 respirator can be reused every fourth day by keeping in a box or paper bag, and the virus load on the surface is removed within this duration. Reuse by this method can be done 5 to 6 times. This method can be done 5 to 6 times. Then after perform this reuse method for 5 to 6 times, discard the mask. Then objective of personal protective equipment used in case of COVID-19. First is protecting yourself as healthcare workers. For protecting your patient by limiting spread of infection. Then protecting the community, family and environment. You can see in the picture. Then principle for using PPE in hospital for COVID-19. Personal protective equipment use is based on the risk of exposure and transmission dynamic of the COVID-19. Selection of right type of PPE when caring for COVID-19 patients will vary according to the settings and types of personnel and activity. See, this personal protective equipment can be different according to necessity, either is in hospital or community, and varying is in size. Then rational use of PPE is vital for COVID-19. PPE kit is must required to get a protection against COVID-19 infection. Then PPE should be in the correct size and select according to risk, lower risk or high risk. Types of settings for PPE use, hospital or community. As said in previous slide, PPE can use in varying in place either in hospital or in community. You can see by this picture PPE kit can be used in hospital, ambulance service, other supportive or ancillary service, health workers in community settings or quarantine facility. And PPE use according to the settings and types of personnel and activity. So, for doctor and nurses in hospital, PPE kit contain N95 mask, gloves, double gown, water should be water resistant, and goggles. And for housekeeper or cleaners or sweepers, PPE kit contain N95 mask, heavy duty gloves, goggles and gown and gum boots and hood for isolation ward. Then for housekeeper or cleaners or sweepers, PPE kit containing triple layer mask, gloves and head cover. For health workers in community settings, nurses at supervisory level, activities, field surveillance, clinical examination, conducting field investigation. The PPE kit contain N95 mask and gloves. For quarantine facility, person being quarantined, triple layer mask and wear a surgical mask at all time. This is the recommendation for person. The mask should be changed every 6 to 8 hours and disposed of. Disposable masks are never to be reused. Nurse working at quarantine facility, health monitoring and temperature recording, clinical examination, symptomatic patient. So for the nurses who perform the clinical examination of symptomatic patients and health monitoring and temperature recording, for them PPE kit containing triple layer mask and gloves are provided them. Then support staff. To support staff, triple layer mask and gloves are provided. Then donning and doffing process of PPE in hospital setting. There is a sequence, accurate sequence for donning and doffing of PPE kit. First is donning process. First perform hand hygiene, then wear cap, shoe cover, perform hand hygiene, then wear inner gloves, gown, then wear mask, surgical or N95, then goggles or face shield, then wear hood and wear outer gloves. Let us understand this donning and doffing process by seeing this demonstrative video.
This video demonstrates the wearing or donning of personal protective equipment for attending COVID patients. The healthcare worker should attend to personal needs such as using the restroom and hydration before donning PPE. The healthcare worker is in a designated donning area. Wear personal scrub and footwear. No personal items such as jewelry, watches, cell phones should be brought into the patient room. Ensure hair is pulled back away from the face and your nails clipped so that they do not puncture your gloves. The infection control nurse will assist the proper wearing of PPE and verify successful compliance. She will read aloud each step in the donning procedure checklist and visually confirm and document that the step is completed successfully. Now inspect your PPE. Check for any tear and wear and select appropriate size. Now perform hand hygiene with alcohol-based hand rub. Next, sit in the chair and wear the inner shoe cover. This kit comes with two types of shoe covers. The inner shoe cover is permeable and shorter. The outer shoe cover is not permeable to blood and body fluids and is longer and should be put above the inner shoe cover. Now perform hand hygiene. Next, we have first pair of gloves. It should be smaller than the second pair and should be of comfortable size. Pull the sleeves as far as possible to cover your bare arms. Now wear the gown. Take assistance of an infection control nurse in this step. Do not remove the pepper strip attached at the end of lace. It will be required while tying lace at the end. Identify the end of lace by attached pepper card. Remove the pepper card and tie the lace at the side of the waist snugly without wrapping all around the waist. Now, the infection control nurse will check for the fitness of the gown. Now, wear the N95 mask. To do this, hold the mask in your hand with the inner side of mask facing towards your face. Put on the mask by placing the lower strap behind the neck. The strap should be in contact with skin. Then place the upper strap over back of head. On sides, straps should be above the ear. Fit the mask snugly over the face by pressing the metal part over bridge of nose. Check for snug fit of mask by blowing air inside the mask. Air leak will be noted if the fit is improper. Next, wear hood. In this kit, the hood comes attached with the breather. Wear the breather mask attached with the hood the same way you wore the N95 mask. By placing the lower strap over the neck and the upper strap above the ears. The hood should lie over the gown, covering the upper part of the body. Now wear the second pair of gloves, larger than the first pair. The second pair of gloves should cover the free end of arms of gown. Now perform gown fitness check. Take help of an infection control nurse for fitness check and easy mobility. Infection control nurse gives clearance for leaving the donning area.
Now understand the doffing procedure for personal protective equipment. The following video will demonstrate the Procedure for removing and doffing of personal protective equipment after completing the shift in COVID ward.
You are in a designated doffing area. The doffing room should have a chair, biomedical waste bin, and automatic hand rub dispenser. First, engage the infection control nurse to instruct the doffing process and check for tear and exposed body parts in PPE. Now disinfect the outer gloves using an alcohol-based hand rub. Next, sit on the dirty chair. Remove the shoe covers by grasping the outer surface. Make sure your legs are apart and not touching each other. Disinfect the outer gloves. Now remove the outer gloves. Do this by holding your wrist facing your thumb upward towards the ceiling. Pinch the gloves, lift at wrist, roll it down until it is completely off palm of the hand. Then slide your finger down inside the other hand and pull the gloves completely off your hands. Give special attention that you should not contaminate or tear the inner gloves. Do not snap the gloves, which may cause spray or aerosol production. Inspect both sides of inner gloves. Next, perform hand hygiene with alcohol-based hand rub. Now, we will remove the hood. To do this, grasp the hood and straps of breather mask from outside with both hands. Pull it over and away from the body and discard. Disinfect the inner gloves. Next, remove the gown. First, release the tie, grasp at hip level and pull the gown down and away from the body. Once the gown is off your shoulder, pull one arm at a time from the sleeves of the gown. Arms are punched at your wrists. Then roll exposed side of gown inward until it is tight and discard. Disinfect the inner gloves. Remove, making sure not to contaminate your hands. The process of removing the inner gloves is similar to outer gloves. Dispose the inner gloves. Perform hand hygiene with alcohol-based hand rub. Now put on a fresh pair of gloves. Now, you are going to remove the N95 respirator. It is important that you do not touch the front of a respirator. First, tilt your head forward and use two hands to grab the bottom strip, then pull the sides and over your head. Then use both hands to grab the upper strap, pull the sides and over your head. It is important not to touch in front of the respirator and dispose it. Perform hand hygiene with alcohol-based hand rub. Remove your gloves and perform hand hygiene. Turn around and let the infection control nurse inspect your scrubs for any tear or contamination. Before shower, change into a fresh pair of footwear and immerse the used pair into 1% sodium hypochlorite solution.
So this was the ideal steps for donning and doffing of personal protective equipment. Thank you for watching.